In this video, I'm going to present a detailed guide to the most common care assistant interview questions and help you plan strong answers that will maximize your chance of getting the job. So let's look at how do you actually succeed in a care assistant interview. Now, the first thing is you need to get the basics right. So have all your documents ready, like your qualifications and anything they've asked for, like your identification, in a neat professional folder to make a good first impression. Also, make sure you dress formally for the interview to show that you're taking it seriously. The next thing you need to do is you need to know the most common questions. And in this video, I will present to you and show you the most common questions that care assistants get asked. And then what you need to do is make sure you've got answers ready for these. And by the end of the video, you will have strong and confident answers to all of the most common questions, and your interview will go much, much better. The next thing is, if possible, try to arrange a visit. It's really my top tip. If you can, arrange a visit and go and see the potential employer, learn about them. You'll get lots of things from that you can take to your interview, and it makes a really good positive impression on the employer, and it really does make a big difference. So if you can, a visit really is one of my top tips. So let's look at the questions they might ask. So one question that is very important is, what times could you work? And they're going to be really, really interested in your answer to this. So what you need to do is remember it from an employer's perspective. So they have what we call a continuous care requirement. They can't just say to someone, there is no care available, just live on your own and we're leaving you alone. They need to have staff continuously. So they need staff that have good availability. The next thing is they often require variable shift patterns. So they need people with flexibility. And fundamentally, what you are trying to do in this question is show that you meet the employer's needs. If you meet their needs, you look like a much better hire. They may ask things like, can you work on a Thursday? Can you work evenings? Can you work overnight? Can you work weekends? If they ask about a specific time, they are asking because that is what they want. So you may decide to say no, but that will harm your chance of getting the job. The more you can say yes when asked about times, the better and the higher your chances are of getting the job. When you come to answer this question, there are certain things that you can say. So here are some of the best answers for care assistant jobs. So you could say, if you've got great flexibility, I have very good availability, and I can work flexibly to support you to deliver continuous, reliable care. That is a really great answer. If they give the hours on the job advertisement, what you can say is, I am happy to work all the hours that you've published on the job advertisement. So you're basically saying, I can do exactly what you're looking for. That's a good answer. Then what you can do is think about how you can make the answer a little bit stronger. So things you might say to enhance your answer could be, often I can work at short notice, which is a nice thing to volunteer. And then you say, I'm open to working overtime if available, if that's something you're happy to offer. And of course, you would be paid more for that overtime. So there is how you answer this question. The next question they can ask in multiple ways, depending on your experience. They may say, why do you want to be a care assistant, or why did you become a care assistant? And I don't know what your particular motivations were, but what I can do is I can present lots and lots of suggestions of good things that you could say in your interview that looks good and helps you get the job. So let's look at lots of things, and you can pick maybe 5 or 6 of these that match your interests and your motivations, and you can build an answer around those very easily. So you could say that you want a job that is making an impact on patients' quality of life. A good care assistant can really improve someone's life quite a lot. You might say that you want a job that is performing an essential function in society, that care assistants provide a very, very important service that really is a lifeline to lots of people. You might say that I love to help people. That's a good value. You might talk about yourself and say, I'm a very caring person, because for care assistants, they want to hire people who are caring. You could say that you love interacting with patients, because that's what you're going to be doing. And if you enjoy it, you're probably going to be better, and you're going to have better relationships with the people in your care. You could say, I like an active job. You don't want to be sitting at a desk. You don't want to be sitting looking at a computer all day. You want to be up and active, because that's what you're going to be doing in the job. You might say that you've got family experience of caring, that you actually got to see care assistants delivering care and you were really inspired by that and they did a brilliant job, and that's something that you want to do. You might talk about positive previous work experience, if you've had work experience as a carer, or if you've had work experience anywhere in healthcare that is really positive. Talk about how much you love the job, and that could be part of the reason why this is the right career for you. You might say that you enjoy meeting new people, because as a care assistant, you will do that quite a lot. You could say that you like to work as part of a team, because you will be working as part of a team. You might have some experience volunteering in something that's relevant to this, and you can talk about your volunteer experience as an inspiration for doing this job. If you've got relevant qualifications, perhaps you studied something related at school, or you took a course that was relevant that has helped you become more interested in it, or shows that you've got the right qualification to do the job, that's a good thing to mention. If you really enjoy reading about caring, and you could say something like, I have an academic interest in care, that's a nice phrase to use. You could say that you want a highly rewarding career, and you see being a care assistant as something that is a very rewarding career, that you are really passionate at providing great care, and you get a lot of rewarding sort of self-satisfaction from doing that. You may also say that you've got experience caring for a family member, and that you were very good at it, and you would like to have a job where you're providing that care because you see how much of an impact it can make. So what I would do is I'd pick 5 or 6 of these, write them down, and then that is going to be what you talk about in your interview, and you've got a good answer ready. The next question is, what would you do if a family member complained or were angry about the care provided? And what they want to see is that you are someone who's going to do the right thing. So let's look at how you answer this. So the first thing is you say, I would stop and listen. That's the first thing you're going to do. You're going to listen to them, because when someone is complaining about care and they've got a problem with the care someone is receiving, they need to be listened to. The next thing you say is, I would show compassion. Then you say, I would be understanding. So you've basically reassured them that you're going to do the right thing. Then we need to enhance the answer. So you say, I take all complaints very seriously. That's a nice thing to point out because it's very important. The next thing you say is, I would follow the appropriate complaints policy. So you're not going to just do your own thing. You are going to follow the complaints policy, and you care about doing the right thing. Then what you say is, I would consider any safeguarding implications. I mean, there might not be any safeguarding implications, or there might be very serious safeguarding implications. The person could be complaining that the person has not been given the medicine they need to stay alive, or they could be complaining that the person has missed their favorite television program. They are 2 different sets of complaints. Some of them have serious safeguarding things, and if it does, that needs to be a very high priority. And then to round off your answer, you say, what you're going to do is you're going to support to resolve the issues and ensure excellent care, because that's the fundamental point of this. Is if the problem has been identified with the care, you want to support to fix that, and it might be by passing on that complaint to management, or it might be a very simple complaint that you can resolve yourself in line with the complaints policy. So that is how you answer this question confidently, and you show the right values. So have an answer ready for that, and you will pass that question. Then a question that they could ask about is, what do you know about safeguarding? And you are expected to know about safeguarding, and they will be very interested in your answer to this. They may ask questions that relate to safeguarding. So if you identify a safeguarding question, remember that you must get this right. If they ask you to prioritize things, safeguarding usually comes very, very high up and almost always at the top of your priorities. That's a good thing to remember. So if they ask about safeguarding, what is it? Here is how you answer it. So you say it is an absolutely essential part of good care, and be very strong about that. Basically, reassure them that you know that safeguarding is very important. Then what you say is, safeguarding is about protecting a citizen's health, well-being, and human rights. That's a nice general overview, but then you want to make it a little bit more specific to a care assistant role, where you say, for example, for a care assistant, this would involve protecting against abuse, neglect, and harm. So that's one of the things that you're doing in your safeguarding. Then what you do is you're clear about something. One misconception is people think that only senior staff have to deal with safeguarding. That's not true. What you do is you reassure them. You say that safeguarding is a shared responsibility of every staff member. As a care assistant, you are a really important part of safeguarding patients, and you are part of the big team, and it's partly your responsibility. So you make it very clear that it's a responsibility of every single staff member. Then what you say is it must be highly prioritized, and then you can just mention at the end that it's controlled by the organization's safeguarding policy. There should be some policy that sets out how safeguarding incidents are dealt with, and you say that you will follow that policy. So that's how you answer the question, what do you know about safeguarding? Be confident and be really strong on the fact that safeguarding is important, and you'll be successful on this question. The next question is, how would you deal with a very confused patient? And it's good to know how to deal with this properly based on the evidence and the research that people have done. And also to show that you have the right values and that you're going to deal with it appropriately. So the first thing you say, and you're very clear about your values, you say all patients must be treated with understanding and compassion. That's a very simple statement, but it's the right value. They want people that treat people with respect and compassion. So be clear that that's something you will do. Then you say you use a gentle, reassuring, non threatening, and calm approach. When someone is very confused, shouting at them, being loud, being aggressive, pushing them around, making demands is going to be really, really, really bad. You're going to reassure them that you're going to be gentle, non-threatening, and you're going to remain calm at all times, because that's how you're supposed to deal with it. Then you say that you'll tailor individual patients' needs in collaboration with the care team. So the doctors and nurses and other people that have put in place care plans, you're going to follow those, and you're going to deal with each confused patient differently. So someone who's got confusion because of dementia and someone who is confused because of a different medical condition will need to be dealt with in different ways. So you're going to take an individual approach informed by the guidance that's been put down. The next thing you say is that you would look to understand the patient's underlying condition and use best practice to manage it. So you're going to know why that patient is likely to experience confusion, and you're going to deal with it in the right way depending on what the condition that's causing that is. Another simple thing to say is hearing aids and glasses may be part of that if you have someone who is particularly old, and part of their confusion may be that they can't hear because their hearing aids are not being turned on, or that they can't see what's going on, so they're more confused. But if you give them their glasses, that is one step towards reducing the confusion. Then another thing that is informed by evidence is where someone is experiencing a lot of confusion, there's reorientation strategies to try and bring them back and help resolve some of that confusion. So things like family involvement, if possible, recordings, photographs, clear explanations. So someone who is confused may ask the same question over and over and over again, and you've got to be really patient with them, and you might have to answer the same question 10 times, and that's fine. They are confused, they may have memory issues, so you've got to be patient with them. You want to also remove a lot of distractions. You don't want 20 people speaking to them all at the same time, one person speaking at a time, for example, to minimize the stresses. You want a low stress, calm, controlled environment that treats the patient really well and tries to deal with their confusion as best as possible. And that's how you answer this question. The next one they might ask is a general one. What makes a good care assistant? So I'll just give you a simple list of things that you can say in your interview about what makes a good care assistant. So they obviously have to be caring. They should be professional. They should be compassionate. They should be able to prioritize. You will have conflicting demands as a care assistant. You've got to know what's most important to provide safe care. They should be empathetic. They should be patient. They should be a team player. They should follow procedures. You're not a senior doctor. You're not going to be setting down what the rules and procedures are. You're going to be spending your time following them, and they need to be followed carefully and accurately to deliver good care. They are patient-centric. They actually care about patients. They're observant. They pick up on things. They always try to be part of improving the care. They may have to be physically fit because it's quite a demanding job, calm under pressure, diplomatic, and of course, competent, that they know how to do the job and they do it competently. So I would pick from this list maybe 7 or 8 of these and just list those. So I'd write those down, perhaps memorize those. And if they ask what makes a good care assistant, pick some of those and you'll have a ready-made answer to that. Then they might ask, can you tell me about your previous work experience? And in this one, you've got to prioritize. Don't tell them about everything in minute detail. You've got limited time, focus on the important things. So you want to focus on care experience. If you're applying for a care assistant role, talk about your care experience first. Then you talk about your wider experience, so other jobs that you've had, but you want to think about how does your other jobs make you better at this? So if you've worked, for example, in a supermarket or you've worked in a restaurant, you've got lots of experience with dealing with the public, you've dealt with complaints, you've delivered good service. These are some skills that will help you in being a care assistant. Any care training and qualifications you have, remember that folder. I suggest that you prepare. You could show them some of your qualifications as well, which is a good thing to do. And all experience you want to relate back to being a care assistant. So if you say in the past I've done this job, and from this job I'm going to take these skills and use it as a care assistant. Let's look also at some phrases you might use. So talk about any experience you've had working with patients, highlight any times that you've dealt with complaints, that you've done maybe manual handling training, that you've done safeguarding training, that you've maybe cared for a family member, so you've gained extra experience as a carer and you've gained an insight into what families value in terms of delivering care. You've got experience maybe working with vulnerable groups, maybe you've worked in a school and you've got experience of that as well. Any qualifications you've got from school related to care, that's a good thing to mention. And if you've got experience in communication and you're good at communicating calmly with people and you've worked in teams, that's also a great experience. So focus on the experience of care first, then healthcare second, then your wider experience, and then talk about how your experience makes you better at being a care assistant. I would pick as many of those on that list that I've got and talk about those, and you'll have a nice answer to this. Before the interview finishes, you will be probably asked, do you have any questions for us? And the answer to that has to be yes. So let's look at some questions that you could ask, and you want to have 2 or 3 questions ready. So one question you could say is, can you tell me more about the CPD opportunities and induction program new care assistants receive here? Show that you really care about your training and you care about getting better. Then you could say what training and progression opportunities would be potentially available for a high-performing care assistant over the next 3 to 5 years. Find out what progression is available and make the point that you're looking to be someone who is high-performing. You could say, I'm very interested in this care assistant position, therefore I'm interested to know the next steps in your recruitment process. Find out when will you learn if you've got the job and what happens next. You could say, what are your main service improvement priorities and how would I be able to contribute to these in your role? So if they say, we're looking to improve this, we're looking to improve that, you can have a conversation about how you can help with delivering what management is trying to achieve. So that's a really positive thing to talk about. And before your interview finishes, offer sincere thanks for the interview, reinforce your interest in the job to the interviewers, and end on a positive, and then hopefully you'll be successful. So I wish you the best of luck in your care assistant interview. I'd appreciate if you post in the comments what questions you were asked and that you like and subscribe. And finally, thank you very much for watching.